Thank you for joining us for the third session in our series Equity in Care, Stories and Insight in Alopecia Areata. I am Alessandro Monaco, a senior healthcare manager with a focus on regulatory affairs and policy making. I bring my perspective and experience working with the institution at both national and international levels. And I'll be your host today. In the first two videos, we explored the challenges patients face in obtaining a diagnosis and the complex and daunting process of accessing optimal treatment. In this session, we turn our attention to a critical ongoing challenge for many: access to advanced therapies for severe alopecia areata. Today, we'll explore the situation in Europe, where progress has been made and what challenges remain. In Italy, advanced therapies for severe alopecia areata are currently reimbursed at the national level. However, before patients can start treatment, eligibility criteria and allocation decisions must be made, introducing potential delays or limitation in who ultimately receive the therapy. Education and awareness around alopecia areata represent critical areas where coordinated efforts from all the key stakeholders are needed. We'll be looking at what this means for people with alopecia areata living in Italy and what might happen next. In France and UK, advanced therapy are also reimbursed nationally, which in theory means that all patients should have access. But people in these countries still experience barriers to access. We will explore these issues and understand more about the advocacy work that is ongoing to address them. And finally, in Germany, reimbursement law specifically prohibits funding for hair fall treatments, meaning that advanced therapy for severe alopecia areata are currently not reimbursed. Is that the end of the road for people hoping for advanced therapies, or is there a path to access? We will explore what this will take for reimbursement of advanced therapy and look at the ongoing efforts by patient advocates to secure access in Germany. Discussing all this with me today are my fellow panelists. I'm pleased to be joined by Dr. Leila Asfour, expert dermatologist specializing in hair loss, president of the British Hair and Nail Society and member of the EADV Hair Task Force. Carlotta Sezzi, patient advocate and member of the Associazione Italiana Alopecia Areata. Jonas Labermeier, patient with lived experience of alopecia areata, PAG representative based in Germany. Jean-Marie Meurant, president of the VPOC and patient representative for alopecia areata and other dermatological conditions. Let's start with the first question then. And I really would like to start the conversation with Carlotta Sezzi in the theme of the Italian context. In countries where advanced therapies are reimbursed, we know there are still problems to be tackled. We recognize that access to treatments may not be yet fully adequate. What is the situation, Carlotta, in Italy for people with severe alopecia areata in accessing advanced therapies, and what are the remaining challenges?
The situation in Italy is quite complicated because, as you know, we have a central government about healthcare in Italy, but every region follow a different path. And so for patients, it's quite difficult to get the right therapy in their region. And fortunately, at the moment, we have a new proposal of law in which we ask to be recognized as a disease so that we can afford all the treatments to everybody in Italy. This is really important for us because we have a lot of families and small children affected with alopecia, and we need therapies and psychological support as well, because really alopecia areata, if you don't have it, you can't understand what it means. It's like an hurricane in everybody's life. It changes everything, and we need to support all the families and all the children.
This is very interesting. It's sort of a way to restore the visibility and credibility of these people suffering of this disease, or thousands of people suffering of this disease. Could be also a way to improve the economic and geographical access to the treatments to thousands of individuals. So thank you. I would like to now move to Jean-Marie. Jean-Marie, how similar are those challenges to what people are experiencing in France?
Well, I would say the situation, the same, not so complicated as it is in Italy, but what we need to know, it's the fact that the impact, the burden of alopecia areata is really, my point of view, misunderstood, minimized. And it's not because the people don't want to treat the patient, it's because we need, as patient organization, to aware and to advocate. And it's important that all the steps of the health decision will be informed about the burden, which is not the case today. It is at the top of the health administration to know them about what the people are experiencing, what you say, how the family need to handle the disease and the parents and the children, and also to go to the different steps, to the GP, to the dermatologist, to the hospital dermatology department. So it's important that we can invest in advocacy, in documents that explain the disease, and to be able to have a network with the dermatologist and the researcher in order to bring the patient voice with the scientist data. It's important to do that like this.
And I think in that perspective is also very important what Carlotta has been reiterating about subnational differences, mostly generated by commission groups or other regional authorities that makes the access to advanced therapy in alopecia areata even more heterogeneous throughout the nations.
Yeah, I would say it's. I come back to the burden. When you don't know the burden, you don't treat the people. The cosmetic condition of skin diseases, when it is maintained at its a cosmetic condition, nobody will take care about because it will be only a personal situation. When it's come to be classified as a disease, as an autoimmune disease, it brings it to the radars of the HCP, because today alopecia areata is under the radar. So we need to bring it again in the vision of the HCP. And this needs to be done in every hospital, for example, because if you have some HCP in a hospital not convinced about the need of treatment, the team will be not taking care about that. So we need to influence, we need to aware, and we need to advocate to those levels too.
Thank you very much.
Welcome.
Jean-Marie, any positive outcomes from your patient advocacy activity?
Yes. What we discuss is really important. I will bring back to France a really interesting subject. As a French Skin Federation, we do not have today an alopecia areata patient organization, so we are representing them. But what I see, it's due to what you said, both of you, regarding the guidelines, the recommendation. We need to get yours and to be able to push forward into our health system in France to get it, because you will, I would say, minimize the inequity of getting the treatment. So it's really important, and to tell to the people with alopecia areata that they are really important. It's really important to build new patient organization in France, and that they can be joining all the other patient association around.
A question for Dr. Asfour. From the physician perspective, what do you see as the major access challenges in the UK and beyond? In the UK, how things have changed over the past few years, and what has improved as well as the challenges still to come?
So in terms of acknowledging alopecia areata as a medical condition, that has been the case for many, many years, because the British Association of Dermatologists have listed it as one of our dermatological conditions. We had patient leaflets, we had guidelines for GPs, so it was always known that this is a medical problem. But it's what you're saying, Jean-Marie, about understanding the burden of the disease that has been misunderstood even at this moment that we're speaking, there's still healthcare physicians or GPs that may not be referring their patients in because they might feel that it's not necessarily requiring the priority compared to other conditions. And it's like what Carlotta described, we do have access to advanced therapies on the National Health Service. This was through an application where the funding body for the government does all the economic analysis and the metrics, and they look at the numbers. We had a lot of struggles because some of their metrics have to do with physical disability, which alopecia areata may not sort of tick those boxes because they're trying to compare it to other conditions like cancer or conditions that have to do with limiting someone's mobility, etc. Whereas alopecia areata has a long-term burden that cannot be put down in numbers that easily. And the way we were able to overcome that barrier to help us help them understand what the type of condition we've been dealing with is by working with Alopecia UK, the patient charity, and have patient representatives come to some of the appeals to share their stories. So when you just see a condition on a piece of paper, you can't really appreciate what it means to live with that. So hearing those stories really helped us give them an insight of what it is day to day, what a young person who suddenly loses their hair, the impact it has on their career, the impact it has on the relationships, like you said, in terms of children, the impact it has on the families, the impact it has even on elderly people who suddenly feel that they're not themselves. So it was quite a landmark moment to have the patients being involved in this process, and they were crucial to the success. Now, we still have barriers because, like you said, Carlotta, there's different regions are applying different policies, even though we have the national policy that says all severe alopecia areata should have access to advanced therapies. Different regions will say that they don't have the funding or they don't have the priority for it, etc. So there is what we call the postcode lottery. Depending on where you live, it depends what kind of access you get. So we're working really hard to break down these barriers to try and make sure that healthcare professionals are advocating for their patients. So dermatologists will often liaise with the British Association of Dermatology as well as the British Hair and Nail Society to tell us when they've had issues in getting funding for their patients, but also educating patients, empowering them that they do have access to treatments to sort of get to help them create those pathways if they're not there already. There is also the European consensus from hair specialists about treatment of alopecia areata that is worth referencing. So definitely, I think as more guidelines come through, it will help empower us with advocacy in terms of policymakers and funding bodies.
Clearly, you mentioned something extremely important, which is one of the biggest challenges of advanced therapy in alopecia areata, which is health technology assessment. Also, in the context of prioritization of pharmaceutical budget and identification of where the clinical priorities are. And this was, I think, one of the biggest challenges that those therapy has to overcome. And this is where probably patient association, in collaboration with physicians, but also in collaboration with institutions, can really provide a push toward more sustained and reliable access and uniform access to those therapies. Dr. Asfour, has been there any positive achievement in UK for what concerns the access to alopecia treatments?
So we've had several positive steps for accessing care in alopecia areata in the UK. We were successful in getting a funding application for one of the advanced therapies, and this has been available for our patients since July last year. We also had the British Association of Dermatologists guidelines, which were published around the same time, which advocate about using advanced therapies for patients with severe disease. And we also drafted a guidance on how to utilize the specific treatment in clinics for dermatologists to support them in terms of scoring as well as in terms of patient support and education whilst being on treatment.
Now, a question for Jonas. We know that the situation in Germany is quite different, as advanced therapies are currently not reimbursed. What is the current feeling among people with alopecia areata in Germany at the moment?
Yeah, so at the moment, one word captures us really well, it's frustration. So there are some people who have access due to clinical trials, or there are some people who have access due to private insurance, which is like a 9%, 10% maximum of the patients. And they get treatments for a certain period of time, but it's not really clear if they can continue it afterwards or not. And just this inequity and not being able to choose whether you want to go for therapy is really frustrating. And self-empowerment is, in my opinion, one of the biggest points when it comes to alopecia patients, to have that decision to say, okay, I do want to have treatment and be reimbursed and not rely on some lie that you have a secondary disease or anything else, basically, to get advanced therapies.
What do you think it will take to get reimbursement in Germany?
That's a quite complicated question, because I do think that the scientific evidence and all those studies are really important. But the main issue is that in Germany, the situation is following. We have a social code book, and that it clearly states hair loss as a cosmetic condition. Now we are way further with the research in alopecia areata, and we know that it's an autoimmune disease which has inflammatory aspects, and we should know that it's not just hair loss, it's a systemic whole body thing. So trying to navigate the law is really important here. But so far, the courts really have been quite conservative with their decision and their rulings, because they see old rulings and they say, okay, there was a precedent case like 30 years ago, we stay with the old ruling. Even though you present new evidence and clinical studies, it's still sometimes really hard to convince people that there's a real burden of life there. But I think mainly it's navigating the situation, leveraging the research, leveraging the advocacy, so giving the people faces to the disease. That combination could definitely force some change there. And other countries, that's a big part. If all our neighbor countries start to suddenly reimburse medication, Germany falls into a space where it's like, how can it be that a very developed country in the middle of Europe, one of the economic strongest countries, suddenly not reimburse a disease which all other countries do? So those combination of aspects is, I think, the way to go.
In the case of Germany, it's my point of view. It's really a question of understanding why Germany is still considering alopecia areata as a cosmetic condition.
Yeah.
So we need to turn, it's really important to turn the decision about this to get the better reimbursement.
Yeah, definitely. I completely agree with that. It's mainly the reason why Germany has that law is basically, if they see a patient coming in, they see hair loss. So you go in front of a court and you say, hey, I don't fall under the category of hair loss because I have an autoimmune disease. And they will be like, well, what's your symptom? Yeah, well, hair loss. And that's the hard part to navigate. That's where you need clinicians who step in and say, well, it's actually having more effect than just hair. It's affecting nails, it has comorbidities and all those things. And I think that is a major step forward. And since we have more research coming out every year, I feel like the direction is definitely more into that. Just looking at private insurers, there was a huge change with advanced therapies. So my hope really is that we can make that happen for public as well.
So in the United Kingdom, we had a similar issue where they couldn't quite comprehend, you know, what's the problem? Just they lose their hair, what's the actual problem? You know, so then we had to sort of explain to them. They appreciated that there's pathobiology, there's there's inflammatory pathways, we have histology that proves that, we have, research and trials that prove that it's not just a cosmetic of, like all other types of hair loss that people would expect that can have age-related as such. So we were saying, okay, so you're funding treatments for atopic dermatitis, but you will not fund treatments for alopecia areata. So how do you justify this? Okay, so they lose their hair, they get itchy skin, but both have an autoimmune sort of inflammatory condition. So that was one of the things that we tried to argue, because atopic dermatitis wasn't quite meeting their metrics for disability either, but it was meeting the metrics for psychological burden. So we said, well, alopecia areata can have the same, if not more. So we know from global studies where they've looked at burden of disease, alopecia areata scores higher in terms of impact compared to psoriasis and even melanoma. So we know there's a significant burden there from objective studies. So we said, so why are you not, you're willing to fund treatment for one patient group, but not for the other. So you need to really justify why you're discriminating against this group. It's not quite well working out for vitiligo for us yet, but we're still fighting.
And the data are really important to bring on the table, to present what is the reality of the patient. It's really important. You have the personal testimonies, and you have also the data from a publication, scientific publication, and you need to bring them together to argue and to change. It's a mind change that we need to implement. And it will take some time, I would say. I don't think that it will take too many years, but we need to start and or maybe not to start, to continue to push in that direction. And it will be the coalition between the patient organization, the scientists, and also the Dermatology Society, as you mentioned before, for UK.
From your words, clearly emerge how it is really an issue of reclassification of the disease. And as mentioned, this could take some time, but it's also with the support of clinical data, but I think also from real-world experience and a real-world perspective from patient. I think that this mindset shift could be really proposed, both in the institutional world as well in the science world, and in order to have these therapies available to as much possible. Jonas, we've been very well aware of the barriers and the challenges that are still ongoing in Germany. Do you have any positive outcomes on your current patient advocacy activity?
Yeah, so definitely it starts with our guidelines. It just equalizes care around the whole country, less of a postal code lottery. We had very different therapies offered to patients depending on where they are and just the mood of the doctor basically prescribing it. And with guidelines in place, this is more equalized through the whole country. And also evidence-based and consent-based, which is really a big step forward. On other sides, we've been growing patient communities, local support groups. So from a patient-to-patient work, it's improving a lot. From barriers like reimbursement, there's still a lot of progress to be done.
So Carlotta, what do you think are the most important achievements in Italy for what concerns access and recognition of the alopecia areata disease?
Oh, finally, we have a great progress in Italy as we have a proposal, a law proposal that's been asked at the Parliament on the 23rd of January this year. And we are waiting for the answer, but the proposal is about confirm that alopecia areata is a disease. And so the payment, the reimbursement, and everything that follows will finally be available for everybody.
Dr. Asfour and Jean-Marie, are there any other example of effective advocacy that comes to your mind?
To my mind, it's come directly two examples. One is about disability recognition, and another one it's about a resolution. I am a board member for the French Skin Federation, which is an alliance of the skin, the dermatology, the skin patient association. We were with a lot of issues for people with skin diseases when it's come to the work or when it's come to the environment. And we decided as a skin federation to advocate to get a disability file to be recognized by the health administration. We worked really closely with the health administration to get this file in place and then to train all the disability administration to know about what are the effects about with a skin disease when you have a job, when you need to have a professional life. And it was really interesting because quite nobody did had in mind that when you have a skin disease, it can be you can be disabled and recognized like this. When you miss one leg or one arm, it's okay. You see it. But when you have a skin disease, not like me because it's a visible one, but other skin diseases, it affects a lot your condition, your life condition, and the professional aspect of your life. And maybe you need to change of job because your skin condition. So one effect is and we jumped about, you say, it's to unite and to go to the goal. I have a second advocacy situation, which is the recognition by the WHO, World Health Organization, that skin disease are a priority. Before, there were no resolution about that, and so every country could make what they wanted about dermatological diseases. And end of May, it was World Health Assembly, and they decided, and it was not the majority, it was a unanimity to vote for this resolution, which is crucial for all of us around the world, because the states, due to this resolution, have the needs to implement action plans. So as patient organization, we will have to ask, what is your action plan in the country for the patient with dermatological diseases, which is key for everyone around the table here.
And yeah, I echo what you said. It's to bring all the stakeholders to the table when discussing the matter. And like I said, in the UK, I think we wouldn't have been successful if we didn't have the patient organization, Alopecia UK, involved. They were crucial to the whole process. We did get rejected with some of the applications, and they persevered with appeals. They were very vocal, and they remain very vocal, because there's still a lot of work to be done. Even when you do get access to treatments, it's about how long they give you the funding for. How do we demonstrate the impact that treatment has to their lives in order to be having ongoing commissioning, and also, like you said, Jonas, about empowering the patients to make the decisions for themselves, whether they want treatment or not, or what type of treatment they want. So I think the patient groups are vital in this process, and listening to them and involving them in guidelines, in policies, in funding applications, and research, of course.
I think in this overall perspective that you mentioned, the role of physician is really crucial in kind of bringing all the different experiences and the information toward the institution. So I think that your role here is extremely pivotal in making sure that those instances are actually delivered. Next question is for Jonas. Jonas, what are advocacy groups currently doing to press for better access in Germany? What learnings do you think we can take from the work in other nations to help Germany?
Yeah, so the German association is quite small, first of all. So what we try to is really focus on the patient-to-patient work, and now also focus more on the advocacy. What we've seen in different countries was really that pathways to how treatment should work and guidelines is an essential cornerstone. So that's why the patient organization got involved with the high standard of guidelines in Germany. We did not have that. That means inequity in access, because just people go to different doctors getting different prescription. It's completely randomized by the opinion of the doctor, where we now will be having guidelines which clearly indicate, okay, this is a severity score, you have these options for treatment, and it's not just consent-based, it's also evidence-based, which is really important, because in alopecia areata we have so many treatment options. This combination is really important in opening up the access. The second part where we can learn from is how do you approach, for example, in France, Jean-Marie is the person to talk to, how do you get to policymakers and involved into talking to them even, because it's often unclear who's the person you should talk to, what kind of evidence do you need to bring, because I just can't show up and say, look at me, I have alopecia, it's really hard. We need to have a clear plan, and I think we can take some from other countries, but we have this bigger difference that it is not recognized as a disease. It's like there is a line saying hair loss in the law explicitly, and that makes it really difficult to circumnavigate that. And as I mentioned before, courts usually stick to a more conservative ruling and say, hey, we take what has been used for the past years, we won't make a change. And we need to leverage and pressure them into revisiting that, to ask the right question and say, is it really correct to say it's just hair loss? It's not, but we need to have the evidence ready and hope that they listen.
So again, the opportunity to merge together the different evidences, experiences from all the patient associations all over Europe, it's crucial in order to put forward the instances of alopecia areata, but also to make sure that the access to therapies all over Europe is guaranteed.
Exactly, so that's a huge part. Europe is quite united when it comes to European Union. We have lots of instances where we can collaborate, and this is, of course, an opportunity to say, hey, other countries are doing that, and now we have a resolution from the WHA. What are we still doing in Germany as a very strong nation in Europe, I'd say?
And now a question to all the panelists. Several ongoing efforts aim to harmonize access to treatments across Europe and to ensure this access is balanced and grounded in principles of equity. What scope is there for international advocacy to advance the therapies?
I think there's huge scope, both from physician and patient groups, that if, like you said, Jonas, if you know that, if I lived in the UK, I can get the treatment, but because I live in Germany, I don't. And if I live in the UK, my alopecia areata is validated, but if I live in Germany, it's not, then it helps us to sort of try to provide a standardization of care by saying, okay, these are the type of pathways that have already existed for alopecia areata patients in XYZ countries. This is how funding has been provided. This is what barriers they have experienced. So it's lessons learned from others' struggles and fights and successes. So I think then sharing that knowledge helps us. In the UK, we had to. I reached out to my colleagues in the US and Australia who were also doing funding applications and said, okay, what's your best data? What did you use? So we all have the same approach in order to make it clear to funding bodies across the world without confusing them with lots of different scores and lots of different, information that confuses, and the misinformation that's out there as well, that, it's just cosmetic or it's just hair loss, and pushing the science of it.
And building on this, I think there's another point which is also very important, which is education of physicians, which means basically providing them with the tools for an appropriate diagnosis and treatment and management of alopecia areata treatment. So in this perspective of equitable access to treatment, I think that the physician's education plays a huge role in also harmonizing treatments all over Europe.
Yeah, I totally agree.
Yeah.
And also one aspect I want to touch on is that we see different models of how a patient comes to a physician, whether it's through the general physician first and then getting referred. Seeing different models in work and seeing what are the upsides and downsides is a huge way to say, okay, maybe we should actually go a more general way everywhere in different countries. And seeing successes is, in my opinion, the biggest thing, but also seeing failures and seeing setbacks and how you should recover from those. Because if you have multiple lawsuits in, for example, Germany, and you've lost so far everything, it's getting frustrating. And seeing then there is a potential for success because other countries had the same road, it really brings together, and we can learn from how we should approach certain things. So that's really great.
I think it's really, really important, this question. First of all, if you are alone with your disease, you are quite alone. When you are several together, you have somewhere a little bit more power. And especially at the country level, when you are a patient alone, if you have no patient organization to rely on, to be supported, to be informed, you are lost, and you have only your HCP in regards to you. But you have quite 5 minutes with your GP to discuss about that, and you need to be more heard. And so it's the reason why the support group are really, really important. So you began to bring the people together. When it's come to awareness and to advocacy, then the step is a little bit higher. It's what we need to do. It's in alopecia areata, as you said, to be more united, and not only on the country level.
I think that basically it's really important as an alliance of association, as you told, to improve the spread of the right information to the family doctors, because patients go to the doctor and nobody can tell them what the real diagnosis they have. And that's terrible. They have to go to different doctors, to different specialists, and not everybody is informed about the new advanced therapies. So the association must work on this as well.
I want to tell you about a lady I know. She is responsible of communication in a big company. So, and she has partial hair loss on her scalp. Mm-hmm. So if she is not wearing wigs, people will be looking at her. Don't imagine yourself. Wow, what's happened? Even if you know about alopecia areata. And so she's wearing partial wigs, mm-hmm. and the wigs, they are not growing, but your hair still are growing. So she needs to be, I would say, not beautiful, but to be able to represent the company. She needs to go every month to the hairdresser, and every month needs to have specific wigs or mm-hmm. to change the wigs and so. Do you know how much it costs per month?
That's a lot.
Not reimbursed, 300 euros, which is 3,600 euros per year. So, and it's due to the fact that she has hair losses, that she is inside the professional life. Imagine if she is not working, what will be the cost for the company, for the societies? Okay, so it's clearly, it's economical aspect of, direct aspect of the hair losses, the alopecia areata, and the out-pocket, which needs to be leveraged as also an argument in the advocacy files.
Clearly, Jean-Marie, you're highlighting how hidden and unrecognized costs of the disease are, something extremely important topic to discuss with regulatory agencies that need to recognize the value of advanced therapies. And currently, they're probably prioritizing, in some places, other therapies. And this is probably one of the biggest challenges that we need to tackle all together. And this is why we're here, in order to make advanced therapies accessible all over Europe. So, Dr. Asfour, regarding these, what do you think are the most important body of evidence needed to persuade regulatory agency in order to make these therapies reimbursable?
Now we need the real-world evidence that shows us how do we actually apply these in real life, in real patients. And some of the work that's being done is to look at impact of disease, how much it's affecting in terms of health economics, like in terms of people not going to work, so absenteeism, in terms of how it's affecting them in terms of relationships, in terms of children and education, and impact on parents. So looking through that prism, we're collecting data that will help understand better and in more depth the impact that it has, not just on the patient themselves, but also in society in general, like Jean-Marie touched on in terms of the cost of the disease, but also the cost to society. And I think as more data of that comes through, that will help us, empower us to be able to show them how much treating patients makes such a big difference for someone to have access to the treatment.
So I think that one of the biggest discussion point is the fact that regulatory agencies need evidences to ensure that certain therapies are reimbursed. And let's remember that all over the world, in Europe as well, we're working in a context of budget constraint. So pharmaceutical budgets are shrinking year by year, whereas advanced costly therapies are increasing by the day. And they're replacing cheap small molecules. And this is really a challenge from the institutional perspective in making sure that access on one side is ensured, appropriate treatments is actually making available for the patient, but at the same time you can manage the pharmaceutical budget. So the collection of evidences, of experience, of patient perspective are absolutely mandatory in order to forward the instances to the regulatory agencies, to the institution, in order to make sure that those therapies are accessible to everyone.
We need to have a shift in the studies from epidemiology to socio-economical aspect of the diseases,
Yes.
which is the real key system, because we agree about that. The cost of a disease is not only the medicine. It's one part of the cost. And the hidden face of the disease needs to be leveraged, needs to be highlighted.
Yeah. And there's a lot of work being done. So there are lots of studies now being done, a lot of observational studies, a lot of work that's being done, like focus groups that helps us collect more data that's more objective to help towards this.
I want to sincerely thank our panelists for sharing their experience, expertise, and perspective with us today. It's clear that there are many challenges remaining for people with severe alopecia areata to get access to advanced therapies. Some are unique to certain regions, while others are shared internationally. By working together both locally and globally, we might be able to see some of these challenges be addressed in the months ahead. We look forward to discussing further topics in this series and encourage to explore the resources available on the website. Thank you.